June 1981. The Centers for Disease Control publishes a strange report. 5 previously healthy gay men in Los Angeles have developed a rare pneumonia called pneumocystis carinii, something usually only seen in cancer patients or organ transplant recipients with severely weakened immune systems. It's a single paragraph in the Morbidity and Mortality Weekly Report. Most people don't notice. But for some doctors, this is the moment everything changes. In the summer of 1981, emergency rooms in New York and San Francisco are seeing something unprecedented. Young men, many in their 20s and 30s, are arriving with bizarre constellations of symptoms. Purple lesions covering their skin, Kaposi's sarcoma, a rare cancer, deadly pneumonias, rampant fungal infections, their lymph nodes swollen to grotesque sizes, weight loss so severe they look skeletal. Dr. Alvin Friedman Keene, a dermatologist in New York, starts tracking cases. By July, he's identified 41 patients with Kaposi's sarcoma. In a typical year, he might see one. These men are dying, and no one knows why. The media begins calling it gay cancer. Others use gay-related immune deficiency, GRID. Some doctors refer to it as gay bowel disease, focusing on the opportunistic intestinal infections. But gay men aren't the only ones getting sick. Hemophiliacs who receive regular blood transfusions are dying. So are Haitian immigrants and intravenous drug users. By 1982, the CDC is calling it by a new name, Acquired Immune Deficiency Syndrome, AIDS. The question becomes, what's causing it? The theories are wild and terrifying. Is it a chemical? A side effect of recreational drug use, particularly poppers, amyl nitrite, popular in gay clubs? Immunologists make a crucial discovery. AIDS patients have devastated T-cell populations. Specifically, their CD4 T-cells, the cells that coordinate immune responses, are nearly gone. In a healthy person, CD4 counts range from 500 to 1,500 cells per microliter. AIDS patients have counts below 200, sometimes dropping to single digits. The immune system isn't just weakened, it's been specifically targeted and dismantled. This points toward a viral cause. Researchers begin investigating the HTLV family, human T-cell lymphotropic viruses. Dr. Robert Gallo at the National Cancer Institute had discovered HTLV-I and HTLV-2 viruses that could cause certain leukemias. Could AIDS be caused by a related virus? In 1983, 2 teams make the breakthrough simultaneously. Dr. Luc Montagnier at the Pasteur Institute in Paris isolates a virus from the lymph node of an AIDS patient. He calls it LAV. Meanwhile, Dr. Robert Gallo at the National Cancer Institute in the United States isolates what he calls HTLV-3. By 1984, it becomes clear they've found the same virus. Eventually, it receives its permanent name, Human Immunodeficiency Virus, HIV. So what exactly is a retrovirus and why is it so dangerous? Most viruses work like hijackers. They break into your cells, force them to make viral copies, then burst out to infect new cells. Your immune system can eventually clear them. Retroviruses are different. They're saboteurs. When HIV enters a CD4 T-cell, it carries an enzyme called reverse transcriptase. It converts the virus's RNA into DNA, running the normal flow backward. That viral DNA then inserts itself permanently into your chromosome using another enzyme called integrase. Your cell now carries HIV's genetic blueprint forever. Every time the cell divides, it copies the virus too. You can't kill HIV without killing the cell itself. Most insidiously, HIV can remain dormant, latent, for years. Hidden in its DNA is a ticking time bomb. This latency makes HIV nearly impossible to cure and allows infected people to feel perfectly healthy while spreading the virus. If HIV can hide for years, how do we detect it? Scientists developed the ELISA test in 1985, a screening test that detects HIV antibodies in blood. It's sensitive but can produce false positives. Positive ELISA tests are confirmed with the Western blot, which identifies specific HIV proteins. Together, these tests revolutionized diagnosis and made blood donation safe again. Later, PCR allowed doctors to measure the actual amount of virus in the blood, the viral load. This became crucial for monitoring treatment effectiveness. Here's what we learned about HIV's timeline. Within weeks of infection, acute HIV syndrome, flu-like symptoms many people dismiss. Then, clinical latency. The person feels fine. This can last 8 to 10 years without treatment, but the virus is slowly destroying CD4 cells. Finally, AIDS. The immune system collapses. Without treatment, death typically follows within 2 to 3 years. But in the early 1980s, there was no treatment, only diagnosis, fear, and death. By 1985, scientists understood what HIV was, how it worked, and how to detect it. But understanding your enemy and defeating it are two very different things. The death toll was mounting. And while scientists raced to develop treatments, much of America still didn't seem to care. That was about to change. Episode 3, Faces of the Epidemic, when America started paying attention. Visit unbedsidemanners.com for more stories and insights.